Hi everyone, Alastair here, which means it's Tuesday, which means it's time for another In Conversation. And my guest this week has achieved something that very few of us could ever dream of doing. He has literally changed millions of lives by bringing the gift of sight to people who would otherwise be blind or visually impaired. And I'm delighted to say that he is here with me now to tell us how he does it. He is Dr. Robert Walters. Dr. Walters, welcome to In Conversation.
Thank you so much, Alastair. It's a pleasure to be here.
Now, my instinct's to call you Dr. Walters, but you did tell me about 30 seconds ago I could call you Rob, so I'm going to call you Rob, if that's okay. You're an eye surgeon, an ophthalmologist working in, or you were working in the British National Health Service. I think you now have a private practice. But most importantly, in 1994, you became a medical volunteer with an organization called Orbis. So to get us going, could I ask you to outline for us just what Orbis is and how you came to volunteer with them?
Thank you. Yes, Orbis has been a complete inspiration in my life. And as you say, in 1994, I went on my first mission. Orbis is a sight-saving organization, charity within the world, and it is dedicated to the treatment and prevention of avoidable blindness in the world. And we do this in a number of ways. I mean, we do that through program, we do it through advocacy, we do it through instruction, by capacity building. So it's a very varied approach, but it's extraordinarily effective.
And I'm endlessly curious about the choices people make in their lives. What just to go before Orbis, we talk about Orbis. What was it that made you want to specialize in something as specialized as eye care, eye surgery?
Well, that's a great question, because it is actually a truly extraordinary specialty to be in. I mean, I used to say to the medical students that there wasn't a disease they could name that might not manifest itself in the eyes in one way or another. And so really it's a panoply of medicine that's driving through you. Ophthalmology represents almost all there is in medicine. And the thing that really inspired me in addition to that was that a friend of mine was also an ophthalmologist who was older than I was, and he showed me what he did. And he invited me into his operating theatre and showed me a cataract operation. And that was so inspiring. I thought, yeah, this is what I've got to do.
And how did that lead to volunteering for, and I really want to insist that your work with Orbis, and we'll talk more about them, but your work with Orbis it's all voluntary. Everybody who works for Orbis is voluntary. Is that correct?
Absolutely. Yeah, of course. All the eye surgeons, all the nurses, all the other specialties we require, anaesthetists, etc., are all volunteers. And what led me into it, I had heard about Orbis, I was already learning to fly. I loved the whole concept of what it did. The Flying Eye Hospital is just a complete inspiration. And so I'd heard about it, and I loved the idea of the work they did in developing countries, helping people who could not help themselves. And then one day I was giving a lecture in Bristol, and someone in the audience was working with Orbis, and they invited me to join. And it was like manna from heaven, from my point of view.
So you didn't hesitate?
Not at all. Not.
So you referred to the Flying Eye Hospital. James, can we put up a visual of that just so people know what we're talking about? And tell us about the. Well, first, how did an NGO like Orbis get hold of a plane like that?
Well, it's paradoxical, really, because all three planes that we've had, and we started in 1982, all three planes we've had have been donated. Wow. It's given to us for free. And then we fit them out with donations largely from the aviation industry, who have continued to support us through the 38 years we've been working. And so it's extraordinary how generous people have been. So that all the aircraft were donated, and we just put together the aircraft into a fully accredited Flying Eye Hospital, the only one in the world.
Fantastic. And when I was doing my homework, Rob, for this prior to this conversation, there was one statistic I came across that really jumped out at me, and that was a statistic sent from Orbis. The statistic is that 200 and 53 million people in the world are blind or have visual impairment. And this is the bit that really got me, of which 80% is treatable or preventable. And not only that, it's relatively cheap and straightforward to do. And I just thought that was a pretty shocking statistic when you have something that is that fixable.
Yeah.
That inflicts 80% of 253 million people. That's a lot of people.
It certainly is. And 253 million people, 75% of the entire population of the United States. So you can imagine that. And but it is an extraordinary issue that many people who live in very, very poor countries in the world, and unfortunately, many billions of people do not have access to many forms of medical care, and in particular ophthalmic care. And that is very much the case in sub-Saharan Africa and in parts of the poorest parts of Asia in particular, and South America.
Right. Well, let's take a break for a little. It's a 3-minute video here of Orbis operating in Mongolia, and this will give a lovely idea of what it is that you and Orbis do.
Унтусаал тоглоомоолын талбай молоо тоглоулахаар унтусаал. Ер нь тэгэл цэцэрлэгтүүд явах ямар ч боломжгүй байсан. Тэгэл
Every day I'm reminded of the miracle of sight and how disabling blindness can be, and how all of that can be undone in about 5 or 10 minutes during the cataract surgery. And you'll see someone who's been isolated, and in one day they're able to literally see better than I do without my glasses. For me, that's incredible. Orbis is a global nonprofit organization that is focused on eliminating avoidable blindness in the developing world.
This is our flying eye hospital, the MD10. We're in Ulaanbaatar doing surgeries this week. So in 2012, FedEx donated the airplane to Orbis.
The plane really is an engineering masterpiece, and FedEx has helped us not only bring the best people, but also the best technologies and the best hospital supplies to all of the places where we go. For me, that's kind of exciting, where you took a plane, totally repurposed it for something that never it was intended to do, and now it's become a beacon of hope and really an icon for all of global ophthalmology. The first day of the week, we pick cases that are very good demonstration or teaching cases. So that screening day is a very long process, but it really sets the tone for the week.
He will be a complicated case. We probably will do him on a plane.
So then we do 4 days of surgery. We'll do lectures in between the surgeries while we're waiting for the patient to wake up. So it really is a really interactive global classroom for doctors, nurses, anesthesiologists, and biomedical engineers.
Got away with another one. She should do fine.
After they finish the surgery, the person will go back to the laser room, they'll get a little post-op, and then pretty soon they'll walk off the stairs. It's really incredible to see them. They come on the plane and they cannot see. They go off the plane and they can see. And one day their life has changed.
Can you see?
I don't know of another plane where you can transform a life by having someone walk on, have a surgery, walk off, and the next day the kid's playing soccer, or they're seeing their parent for the first time, or the grandparent seeing the grandchild for the first time. For me, breaking up that vicious cycle of blindness and poverty is a really powerful thing, and it doesn't get old.
ийм гоё эмчнэр ирсээд ингээд гоё болгож байгаа нэг яах нүд сайхан нүдтэй болоод гараад ингээд аюу ихтгэлтэй л сайх юм их юм. Би одоо сургуульд одоо оруулаад тэгээд маш сайн сургаад тэгээд хүүхдээ одоо эмч болоод болгоно гэж бодож байгаа.
That's a lovely video, Rob. In fact, I can't help thinking there's something almost biblical about I don't know whether you've ever had this feeling, but something biblical about the way this plane arrives in a foreign land, and the people enter one by one and then leave with their sight restored.
Yeah.
It must be quite empowering what you do.
It is very empowering,
Yeah.
and it's the most fantastic magical experience to go on that aircraft. I mean, you normally the aircraft the flying eye hospital will arrive in a country before the surgeons do, and then we fly in later on scheduled airline. And as you land and you see your flying eye hospital, the Orbis flying eye hospital, sitting there on the pan, it just gives you a flutter to your heart. It's the most fantastic experience to.
Wonderful. Well, there's a question here from Roger in the United States. He says, does air turbulence interfere with surgery in flight, or are there safeguards? Well, I'm guessing you don't perform surgery in flight, or maybe you do.
No, we don't. No, I try to avoid it under all circumstances. No, we only ever operate when it's static on the ground. And but interestingly enough, sometimes you can get some slight wake turbulence from aircraft that are taking off close to you. And but the operating theatre is, if you like, on gimbals, so that it will actually remove that form of the effect of that vibration that you would get otherwise, because that could have a very significant effect on eye surgery.
Oh, the whole theatre's on gimbals. Gosh, that's amazing. Wow. Okay. And a question from Delphia in Loveland, wherever that is. I assume you have to turn some people down, not for lack of ability to help them, but for lack of time on the ground. Do you then go back to that destination, or do you move on to another place in need?
No, we always ensure that everybody we see, whoever it may be, is treated. So the Flying Eye Hospital, which is a relatively small part of the clinical work we do a great deal more through country programs on the ground. But the Flying Eye Hospital is largely a teaching capacity building entity. So we will be choosing cases normally on the Monday to run through the rest of the week. We will have what's called screening day, and we will screen all the cases. There'll be hundreds of people coming through, and to try to find the best cases that we can successfully treat, and we can teach the local doctors and nurses as to how they might like to approach that particular form of surgery and that particular diagnosis. But everybody is treated. We make sure that everybody is treated, even if it's not on the aircraft itself.
No one's left behind. That's great.
Can't do that. You know, we have a duty of care to those people.
Now, you must have been present many times when, just after an operation that you've performed, the bandages are taken off and the patient realizes that they can now see and that their sight has been restored. That must be an exceptional moment, not for them, but also for you. And on that subject, Sylvia in Milford says, do you have one favorite memory of helping someone see, and why was it so memorable? I'm sure you have many.
I do. And to your first question, it is an amazing moment when those bandages are taken off the next day. We normally put a shield and a pad on the first day, and then we see them the next morning back in the aircraft, and we take those bandages off. And the look of joy and the look of amazement on those people's faces who previously had not seen, and these are children and adults, I might add, it's quite extraordinary. And I suppose one of the stories that really springs to mind for me, and I remember so much, is on one of my very first times I volunteered for Orbis, and I went to Khartoum in Sudan. And I didn't really know what to expect, actually. But when I got there, we were looking for patients that we could help, that we could operate on. And we went outside of Khartoum to the plains of Omdurman, where there was a huge refugee camp as far as the eye could see, just extending into the dusty, hot distance, with people going past you, just trying to get water. Their whole lives were taken up with just trying to exist, really. And we were going through this refugee camp, and I came across this young woman who was being led by a child. She was young, she was 23, and she was being led by a child because she was blind. And we examined her there, and it was evident she had really dense cataracts. And she was a very pretty girl, I remember very plainly. But her life, it struck me, was completely blighted. She could do nothing. She, was dependent on other people. She felt as though she was doing nothing for her community. Her life was without hope. So we invited her to come for surgery to the hospital, and we operated on her the next day on the flying hospital. I operated on her, and the operation went well, and we saw her the next day. And that moment of taking that iPad off, and this first time she had seen for 10 or 15 years, was just amazing, fantastic.
Yeah,
you're always inspired by that. And she went on to lead an ordinary life. So she got married, she had children, etc. So that's just fantastic. You can give people back their lives.
Yeah, that's a wonderful gift to have. Yeah, it must have been an amazing moment. Got another question for you, Rob, from Marguerite in Tarpon Springs in Florida. Says, do you think that those with impaired sight have heightened other senses? Thank you for the great work you do.
Thank you, Marguerite. Do you know, I think it's very difficult to say, because I have got good sight, and but I think the answer to that is yes. I think there was a compensatory mechanism in one's brain that allows the other of the five senses to come forward, to allow, and people I've spoken to who have been blind and are permanently blind that's untreatable have said that yes, their hearing becomes more acute, their sense of touch becomes more acute, etc. So I think the answer is yes.
Mm-hmm. Okay, and I'm asking a lot of questions, but they're coming in thick and fast. So stay with it, Rob. Roger again says, what is the most common procedure? What is the most difficult? That's a good question.
Yes, I think there's a two. The most common procedure undoubtedly is cataract surgery. I mean, cataract surgery is amazing. If you think that a third of the world's blind are blind because of cataract alone, and that is just it's unacceptable to me that so many people should be blind or visually disabled simply due to cataract, when in our countries, in the UK, in Europe, in the US, and in North America generally, you can have that operation done very readily, very simply. An operation that takes 15 minutes and is very inexpensive indeed. So that is undoubtedly the commonest operation, and it's the commonest one we teach, because teaching that operation will allow the countries where we visit to start serving their own population, and they can do that well. So a simple, wonderfully effective, straightforward operation with very few complications generally. So that is certainly the best and the most effective operation to teach, and the commonest one we do teach. The most difficult, I would have said, is probably corneal surgery in patients who have got very badly damaged corneas, where they become very vascularized and the scarring is very profound, and those are very difficult to treat. So there are some very difficult choices to make, I feel, in terms, and I think one of the most tragic things, and this reminds me of a story when I visited the Rohingya refugee camp in southeast Bangladesh last year, which was an extraordinarily profound and an emotional visit, really, to see these people, because this woman was in the queue of the clinic we were running, and I was visiting that clinic. And she turned to me with tears in her eyes, and there were tears in her son's eyes, to say, can you cure my son of blindness? And I examined him, and he had very severely scarred corneas. And I knew that had happened in all likelihood due to a corneal ulceration in childhood, due to an infection which could have been treated at that time in childhood with a simple tube of ointment that would maybe cost $1. And I thought, there's this boy that for lack of treatment at that time is blind now, and there's nothing I can do for him. I can do nothing for him in terms of restoring his sight, and that's a huge tragedy, and that did certainly affect me greatly.
Do you think there'll come a time at some point in the future where no one will be blind? I mean, it'll be possible to literally just replace an eyeball with a I don't know, some fantastic electronic replacement.
Yes.
Is that a possibility?
Not in my lifetime, Alastair. Just not in my lifetime. I mean, the eye and the neurological system of the eye is essentially an outgrowth of the brain itself, and our knowledge, although we feel perhaps that we are very knowledgeable about these things, our knowledge is just not sufficient at this stage to make those leaps in time. But I think that over the next 100 years, then that might be possible, but not in my.
Well, yeah, neither of us will be around for that one, Rob. Candido in New York says, she says, do you find certain ethnicities have a greater propensity to blindness?
Well, that's a very good question, Candido. And if you fancy it, go and visit our head office in New York and talk to them. But yes, there are undoubtedly genetic predispositions to conditions, and you can have, for example, glaucoma can be the big predisposition in different countries. So you find a lot of glaucoma in Mongolia, for example. In the video you saw earlier on, there's a significant degree of glaucoma there, and also there are a significant number of inherited diseases you will find in certain countries in the world. So there can be pockets of inherited disease, and inherited disease can sometimes be very, very difficult to treat and much better to prevent.
Right. Yeah. And Stephanie in Pasadena says, how do you choose the destination or the patients? What takes you to certain countries?
Yes. Well, I think in many ways, this is a good question, because in many ways the destinations choose us. There was always going to be a degree of symbiosis where you want to find a country where there is an enormous need, and there are many, many countries in the world where there's enormous need, but where we can fulfill that need. So we work in 19 countries in the world. You know, there are almost 200 countries in the world. We only work in 19 because we wish to work in depth for a long period of time. We work very closely with governments. We work very closely with the ophthalmic and para-ophthalmic members of the community there. And so we try to stay there in the long term so that eventually we can withdraw and they can do it themselves. Mm-hmm. I mean, we have a very important part of our armamentarium, which is called CyberSight, which is a telemedicine system. And that actually reaches out to many more countries. But I think we had last year, I think we had 183 countries that we did actually we tuned into, or they tuned into us. So that's a remote form of teaching and of information to the professionals within those countries, telemedicine.
Because the idea is not just to cure people, but to enable other people to cure people.
Absolutely. We are a capacity building organization, Alastair, that's so right. And we could never presume to be able to treat those 253 million people. So what we have to do is to facilitate the countries where those people live, to allow them to do it. So not only in teaching the professionals within that country and supporting them in their work there so that they can be successful, but also advocating with their governments to, and we always work at a very high level with governments and the Minister of Health, but often the Prime Minister and the presidents of these countries would love to come and visit the aircraft. And so we advocate that they should spend more of their money, more of their GDP, if you like, on health-related subjects, but particularly on ophthalmology.
Well, that leads me to a question I wanted to ask you, which was, do some countries not want you to come? Are you ever rejected? Because does some countries see it as being not a slur, but a kind of a sort of not a reflection on their health system because they need you there? Or is everybody always welcome you with open arms?
Well, I must say that that one would have thought that might be the case, but actually I've never been aware of any country not inviting us to come. But at the same time, I mean, we work in partnership with people. We would never presume to know more about their country than they do. We are merely there to act as an adjunct to the work that they do. So we work not only with the governments to ensure that, with the ministers of health, to ensure that we can make a positive contribution, but we emphasize that we're working with them in partnership, and that often we learn as much from them as they do from us. So it is a partnership, and to my knowledge, no one has ever refused us admittance for that reason.
Right. Rob, you've got to put your doctor's hat on for this one, from Laura in Sunnyvale in the United States. She says, is there anything I can do to stop macular degeneration? My dad went blind from it, and I have the same gene. He had one dry and one wet. So that makes sense to you more than me, I think.
Yeah, macular degeneration is a condition, for those who aren't familiar with it, that affects the reading part of the retina at the back of the eye, and generally tends to come on in later life, and normally over the age of 60. I think there are a number of things you can do. For a start, it isn't always inherited, so the fact that your father may have had it doesn't necessarily mean that you will get it. But there are certain things you can do to help to prevent it. A healthy lifestyle is very important, making sure you don't become diabetic, for example, but also not smoking either primarily or secondarily is very important, because smoking, even with vaping, I think is going to be shown that this will affect the retina in no uncertain terms and cause macular degeneration. If you smoke, then you have 25 times greater chance of getting macular degeneration than if you don't. So that's one very important thing. I think the other thing is, in prevention, is also there is some evidence that certain vitamins can help to prevent dry macular degeneration, and that information is available online.
Actually, you just beautifully led me on to something that I came across whilst I was researching the whole subject of cataracts for this conversation. It was one cataract operation that didn't go so well, but it was nothing to do with you, Rob. It was because it was performed 100 years ago, and it was on someone who I have a particular fondness for, the painter and the father of Impressionism, Claude Monet. Claude Monet was diagnosed in 1912 with cataracts, and finally operated on in 1923, though without great success. And interestingly, he was operated on in, I think, the hospital that you studied in, St. Thomas's in London.
Well, that's partly true. I mean, you may see in that picture there that he's wearing a big straw hat. Did you see that?
Yeah.
Knife, and that's because he was getting significant dazzle from his cataract. Cataract surgery in those days was a tricky procedure, and there were no stitches, so no one had any sutures, and so that and funny enough, now again it's gone full circle, but in that there are no sutures now, but we use very, very tiny incisions now. But in those days it was a big incision and it needed stitching, and there were no sutures at all. So you're right, he started to go blind in later life, but by the time he was about 63, I believe, he started really have a significant effect on his paintings. And he was saying to people that the world seems dull to me, everything seems dark, and that he was very frightened of having the operation done. You're right in saying that he initially travelled from Giovanni to London, to St. Thomas's Hospital, where indeed I did do some of my early training, to be diagnosed, and was found to have cataracts, and was advised to have surgery for his right eye. But it was so uncertain in those days that he refused. And he went on until he was virtually blind in 1923, when eventually he did have surgery in Paris, which wasn't successful. But it reflects so much in his paintings, and you see how as Monet gets older, that not only do his canvases become much bigger, so the work becomes much more impressionistic, and a lot of them later on are much darker in their perception. But he actually got to the point where he couldn't really see the colours that he was painting from, and he had to get someone to label his tubes of paint to say which ones were which.
Oh, it's painful to hear that. Yeah, I mean, James, can we pull up the one of the paintings that that Monet made whilst he was severely suffering from cataracts? His paintings became a lot redder in tone, and as you said, more abstract and with much larger brush strokes. Although I think this is a painting of the Japanese bridge at Giverny. I mean, it's a beautiful, beautiful, beautiful painting, but it's very different. I mean, when he saw his paintings after the operation that was successful, a lot of them he destroyed because they weren't what he was intending to do.
Yes. Well, if you look at that painting, and you've been to Giverny, which I have, and I'm sure you have too, you can hardly believe that it represents any particular season of that time. But it certainly is still very impressive. And it's very impressive that this man, despite his vision was so poor, and maybe he was using his other senses, as one of your earlier viewers was saying, should produce something that is so extraordinary.
I mean, also, let's remember, he was a massive smoker. Yeah. And given what you told us earlier on, that may have some, because there is some speculation that the cause of his cataracts was lead in the paint that he used. I don't know whether you think that's credible or not.
No, I don't think it's credible. Lead can cause optic nerve disease, but it doesn't cause cataract. I mean, one has to say that that the majority of cataracts are due to not being 21 anymore, like you and I, Alastair.
Yeah, well, yes, or even 22. Yeah. A question from Thomas in Southampton says, "What actually is a cataract? Are they inevitably part of aging, and how can we reduce our chances of getting them?"
Right. That's a good question. I mean, a cataract is an opacity in the lens of the eye, the lens that lies behind the pupil. And the lens, when we're young, can change shape, and so that you can then accommodate. You can focus from distant to near. But as you get older, the lens the proteins become more rigid, and the lens becomes more stable, so that it won't actually change shape. And hence, in your 40s, most people who haven't worn glasses before require glasses in their 40s or 50s. But, so it's an opacity within that. It's due to a change in the proteins, and that opacity will gradually, in most cases, there are about 20 or more different kinds of cataracts, but most age-related cataracts tend to make the lens itself rather yellow, and later on they can become really quite brown, we call brunescent, and that indeed can reflect itself in many other artists' work that we can name, like Bruegel, for example. Some of his later works were very brunescent, as we say. So it's an opacity within the lens of the eye, and it is the vast majority of people that I see who are over 60, let's say, you will see some sign of cataract in that eye, in those eyes, and usually they gradually progress over the years. They're very slowly progressing. In terms of prevention, I think in developing countries where cataracts are much more common, there is some evidence that periods of repeated dehydration due to diarrhea and gastrointestinal disease can cause cataracts in young people, and that's why we do see cataracts in younger people there. But there's some discussion about the so-called blue light effect, and should we wear dark glasses in very bright sunshine? But I don't think that makes an enormous difference. But just healthy living and looking after yourself is all you can really do. The great thing is for us is that we can get a cataract operation done, takes a quarter of an hour, and is usually incredibly successful, and we have access to that. The majority of those 353 million people we were talking about earlier on, they don't have that access, and that's the real tragedy, and that is what we have to change. That's what us and all of your audience can change.
Yeah, you put it beautifully. I mean, I guess the ultimate success is when Orbis just shuts down the plane, locks the door, and everybody goes home because it's not needed anymore.
Absolutely. I mean, for example, in India, we've been working in India for over 25 years, and we've been working with a number of institutions there over a long period of time throughout India. And some of those institutions have grown in strength and capacity and ability, such that some of our volunteers come from those very hospitals where we first went to engage with them and to teach them the systems that we use, and they've taken them on and become so successful that they now become our volunteers and go out on missions with us. Fantastic success.
There's a whole pyramid effect. Yeah, beautiful. Yeah. Johnny in London says, what impact has coronavirus had on Orbis's program? Has the flying eye been able to operate? Does the virus affect eyes in any way?
Right. Well, I think that other than making some people a bit light sensitive, the virus doesn't affect people doesn't affect eyes and impair people's vision. But like very many viruses, if you had measles, for example, you can sometimes become a little bit light sensitive for a period of time, but that passes. But the answer is that much of our program has been curtailed, and very sadly so. But we are opening up again in Vietnam and Bangladesh. Both our offices are open again there, and we are very much hoping that we will be able to roll out a very important part of our program, which is treating trachoma in Ethiopia. We hope we're going to be able to do that in November and December of this year, whereby we hope we'll be treating probably between 10 and 13 million people for trachoma during that.
That's fantastic. That's wonderful. Tess in Fairfield says, no question, just a thank you for all your good work. Well, I certainly second that. I think we all would. Webster in New Jersey says, who is the oldest and who is the youngest person you have operated on?
Right. Yes, good question. I think the youngest operated on was 104, and she had very dense cataracts, actually. That they were so dense that you couldn't actually see through the cataract to the retina. That was really a fantastic experience. But what was so fantastic about her was that at 104, she wasn't going to give up. She said, my cataracts see, and I'm jolly well going to have them treated. And that was good for her. And the youngest patient I've treated was, I think, probably about 6 months old, a child. And that was for eye movement disorders, for squints, which is one of the things that I specialize in. So that, and it's across the whole age range. Although the majority of people with visual problems are slightly older.
I just think, what a wonderful thing to be a squint specialist. I think that's just great. I love that. That's just wonderful.
It's for me, but not everybody's cup of tea. But
well, I think it's fantastic. It's a good question from Patricia in London, who says, do you think the flying eye concept could be used for other types of medicine? Is anyone doing this already? It's such an incredible idea. World-class surgeons flying in with the medical facilities and equipment ready to go. And thank you for everything you do. That's a pretty good question. Yeah, it doesn't need to just stop with eyes, does it? Or does it?
Really, I think that one of the great things about taking the Flying Eye Hospital in is you're not only teaching individuals, passing on your skills, if you like, but you're also demonstrating how a good modern hospital works. And many of the places I've been to, and I mean, most of the work I've done has not been on the Flying Eye Hospital. It's working in local hospitals. That can be extraordinarily challenging because as a surgeon, you rely on those wonderful systems around you, the fantastic instruments, the wonderful microscopes, etc., that we have where we work. And you go to these local hospitals in very poor countries where really they just don't have those facilities, and it can be very challenging indeed to work under those circumstances. But the local surgeons do work under those circumstances, and they are immensely robust and successful despite that. But it is very challenging.
So, I mean, apart from obviously changing the life of an individual by restoring or improving their sight, Rob, maybe you could say something about more general about how treating blindness can change the world. How it, why is it, apart from the obvious effects for individuals, in terms of society?
Well, I think it does change society, because I think that you have to start off by saying, what does blindness do for society? And blindness is a terrible weight on society in many respects, because if you think of those individuals who are blind, you know, there's vast hundreds of millions of people who are blind, and those children, for example, who have got very poor vision just simply for the want of glasses. There are about 800 million people in the world with that. Then their lives are really put on hold, and so society's lives are put on hold. Those countries' lives, those countries' economies are reduced as a result, because they haven't got the people who can contribute to those to their society. So I think that the treatment of blindness can change the world in no uncertain terms. It allows people to engage with their societies, to take part in their societies, often very simple things. I mean, just to be able to get married, to have children, to look after people, to give to your society, to contribute to your community is so important. And blindness and visual disability will stop you doing that.
I mean, I would wholeheartedly agree with everything you said. And in fact, I go even further and say I think there's almost a moral responsibility on developed countries to do what they can in order to assist underdeveloped countries with a problem that is so significant and so not simply but readily treatable.
Well, absolutely, no, and I think that if you look into developed countries, into the richer countries in the world, they are generally extraordinarily generous, giving their money, giving not only individuals but governments themselves, giving their money to other countries, often through NGOs and charities like Orbis, to actually, if you like, mitigate the circumstances and to try to enable those countries to come forward. Because after all, what we all want is to have healthy nations and prosperous people throughout the world where it doesn't exist and there's no blindness. That would be wonderful.
Rob, that's a beautiful message to wind our conversation up with. I'd just like to say, I think anyone who voluntarily and willingly gives up their free time to help people recover one of the greatest gifts that we have, the ability to see, is a real hero in my book. So thank you so much, Dr. Robert Walters, for not only giving up even more of your free time, but also for what you do, for making the world a better place. We wish you and Orbis good luck for the future, and just maybe one day there'll be no need for flying eye hospitals, because Orbis would have trained enough eye specialists on the ground in each country. That'd be something. That'd be something to celebrate. If you've been touched, oh, by the way, I just want to say, Rob, we've probably had more questions sent in for this conversation than ever. So you've really touched a nerve there. That's great. There's a lot of interest in what you've been saying. And if anybody's watching and has sent in a question and I haven't got around to asking Rob, forgive me. I'm sorry. But we'll send them on to you, Rob, anyway, all the questions, the ones that I've missed. So thank you so much for giving up your time. And if viewers, if you've been touched by the amazing differences that Orbis can make to people's lives and would like to help them continuing to do so, we'll put up a donation, some donation info at the end of this stream. There we can see now on the screen. We'll put that up at the end of the streaming. And I'm told by people who know better than me, there's a button on the page which will take you to take you to a big black suitcase that you can fill with money. So please feel free to do so. Rob, it's been a pleasure sharing this time with you. And once again, you're a real hero in my eyes. Thank you so much for all you do. And thank you for talking to us tonight.
Thank you so much.
So, talking of eyes and vision, before I leave you, a little reminder that we are still running our photo challenge with the title of Looking Out, Looking In. So please do send in your visual interpretations, and also maybe include a couple of lines about what inspired you to take the photo. We'll put them on the Viking.TV platform, and maybe next week, and we'll show a selection after the streaming. In fact, we'll have our own little gallery opening. How's that? So send me your pictures, and until then, from me and the Viking.TV team, from our homes to yours, I wish you well and see you next Tuesday. Thank you and good night.